Let's bring in now Gustavo Ribeiro. He is a political analyst and the founder of the Brazilian Report media outlet. Welcome to the program, Gustavo.
Thank you for having me.
Of course. Now, I have got to start with the situation in Brazil right now. We're seeing spiking daily infection rates and now the second highest death toll and number of cases behind the US. Why are things so bad?
Well, it's a mix of the fact that we have an informal economy that pushes people out on the streets to work and make ends meet, but also because of failed leadership. Since the beginning of the pandemic, the Brazilian government has been COVID skeptic. President Jair Bolsonaro has touted unproven methods to curb, to fight the coronavirus, like hydroxychloroquine, and has been anti-vaccine, anti-mask use. So it's a perfect storm here in Brazil. March has been the deadliest month of the pandemic, and the 31 days of March were the 31 days with the highest individual daily death tolls so far. And health ministry officials believe that by the end of April, we will reach 5,000 daily deaths.
You bring up the President Jair Bolsonaro. He now appears to be engaged in an open race with São Paulo's governor, João Doria, to be the first to produce a Brazilian-made coronavirus vaccine. How close are either party to the finish line?
Well, a week and a half ago, the São Paulo state government announced that they would file a request for trials, human trials, with a vaccine that would be 100% produced in Brazil. And just hours later, in response to that announcement, the federal government said that they had their own vaccine in the same stage. After that, neither party published progressions on that. There were lacks of documentation from the São Paulo side. So at this point, it's kind of stalled, even if those pieces of news offer us a glimmer of hope at this moment. Because the thing is, Brazil right now depends 100% on other countries to get inputs and to get ready-for-use doses. And as countries try to ramp up their own vaccination programs, they have curtailed exports, and the health ministry has cut by half the provisions of vaccines that they expect to get in April, and that has delayed a lot the Brazilian rollout so far.
So really, a domestically produced vaccine is quite important for Brazil.
Yes, exactly, because the thing is, Brazil has an extremely effective vaccination program, but that is more effective in the way that our infrastructure is ready to distribute those vaccines. But we have a blind spot in terms of producing those vaccines, and we rely a lot on India and China. And as these countries, we face competition from other countries, and as India and China curtail their exports, we hang out dry here in Brazil.
Gustavo, I have to quickly ask, because you say the infrastructure is there for a vaccine rollout, but there seems to be rising anger at a new bill allowing companies to buy vaccines and offer them to employees. Many questioning equality here.
Yes, exactly, because the thing is, we are struggling to get vaccines on people's arms already, and this bill, its effectiveness is quite doubtful, and a lot of health experts say that this is just a way for rich people to go over the system and skip the line. We had a lot of line cutting scandals in Latin America, and this would be a sort of legal line cutting scandal from Brazil.